Hello and welcome to Babo the podcast. I'm Mathilde and I'm here to break the silence on vaginismus and vulvodynia. Despite affecting 1 in 5 women, these conditions remain taboo, leaving countless women to navigate their journey alone and often unsuccessfully. My own journey with vulvodynia and vaginismus was in many ways like this, alone and unsuccessful. But through determination and some luck, I've been fortunate to come across experts, treatments, and information that changed everything. And now I'm sharing this with you. Whether you're on this path yourself or supporting someone who is, I'm absolutely thrilled that you're joining us. Today's guest, Violet Meyer, is someone I'm genuinely thrilled to introduce you to. Violet is a clinical massage therapist, a chronic pain specialist, and also the founder of Battersea Massage. She actually came warmly recommended to me by one of our listeners for her compassionate, holistic approach to pelvic pain conditions like vaginismus and vulvodynia. But what really stood out for me is how personal her work feels. She's walked her own journey with jaw pain and chronic fatigue, which led her to explore the fascinating world of fascia, this connective tissue that quite literally holds us together. So in this episode, we talk about what it means to take a holistic view of pelvic pain, how fascia links different parts of the body and why that matters for vulvodynia and vaginismus, and a few simple practical tools that you can start using today to support your body's fascial health. And I also just wanted to mention that Violet uses some really great analogies and even props to explain this concept of fascia. So I've added those clips on our Instagram page, which is at meet.babo, and I'll link that in the episode description as well. With that being said, I really hope that you enjoy this conversation. First of all, a huge welcome to you, Violet. It's such a pleasure to have you on the podcast.
Oh, thank you so much for choosing me to speak to your listeners and share some of my learnings and insights and knowledge with your listeners. Yeah, it's such a pleasure to be with you today.
So I always love hearing the kind of personal stories behind healthcare providers' work, because I find that it really helps us understand the passion and the perspective that they bring into the practice. And I think, Violet, you do exactly that, because through Battersea Massage, you bring your own lived experience and insights to your patients in a way that I think truly shines through. So I'd love to start by learning a bit more about you, if you can share your journey and what led you to this work.
So for everyone who's listening, a very warm welcome and thank you for listening to today's podcast. I'm Violet and I'm founder of Battersea Massage, but also chronic pain and a stress specialist behind. So my story really started probably as a therapist at age of 5. My mom got bedbounded around that age when she experienced really chronic back pains. So during that period, I helped to care for my mom and my sister, and quite often my mom would call me to massage the back relieving pain, and so it's just started really there, but. Fast forward about 8 years ago, I burned out from my own career in management and leadership, and then during that time, I got inspired to go back into my passion, learning about massages, and I found a really amazing school with really beautiful holistic ethos, blending Eastern and Western protocols together to give the best to people actually suffering from chronic pains. And during my studies, 3 weeks into pandemic and the lockdown, I broken my crown, which
like your tooth.
the tooth, the crown would sat on my tooth. And then that started my journey with TMJ problems. So it's really extensive jaw problems, really extensive neck problems, seizing up. And 7 months later, that crown completely broke my tooth. That crown opened the original feeling, which was like silver amalgam feeling. And that leaked into my body. I didn't know that was leaking into my body until a few months later, I started feeling super ill. And I just didn't know what's going on. And during that time, my school was putting the program for massage therapists to come and learn about TMJ. So I said, okay, I'm going to jump in and then I'm going to learn all the techniques to help myself, because I didn't plan to treat really anyone yet, but I wanted to help myself. And that's how kind of my journey sparked. And that sparked me to really say, okay, let's put all the learnings I had of doing my degree level clinical massage into practice, and started slowly building the clinic from the lived experiences, connecting the dots.
Yeah, I think it, as I said, it really shines through. And I think when you have personal struggle that ends up being, as you said, you looking for a solution so that you can try to treat yourself, I think that always sets a really good premise for helping others as well, because you can approach it from a place of a deep compassion and understanding, because you've been in their shoes to some degree. I just want to clarify one term. You mentioned TMJ. What does that stand for?
It stands for the names of the bones, which is temporal, and the lower jaw, which when we open the mouth is called mandibular. So temporal mandibular joint. So that's what the TMJ stands for.
Okay, interesting. And I think the reason why I wanted to have a discussion with you is due to several things, but I think one thing that you are so clearly passionate about is chronic pain and chronic pain management, and approaching that from a very holistic point of view. So I wanted to kind of tie it into the topic of this podcast, which is vulvodynia and vaginismus and other pelvic pain conditions. So when someone walks into your practice experiencing either pelvic pain or painful sex or vaginismus or vulvodynia, what does your process look like of assessing and treating them? Like how do you go about it?
So what I would say, like at the beginning, before people come, they have an option to have the 15 minutes consultation to speak to me. So this is the opening gate. It's like we always need to know if the practitioner is the right practitioner we're choosing to treat that, because it's very intimate and it can be very embarrassing for many people to speak about pelvic pain. So I usually like to ask how long ago that happened, and start the process of being this Sherlock Holmes, connecting the dots. And my job is to ask about deeper questions. Like, so for example, someone coming with pelvic pain, we have to remember that we are a whole person. So there is a physical, which is pain you come in with at the beginning to me. But I also have to understand the emotional attachment and mental attachments into the pain, as well as we have the environmental factors taking place. So all of that needs to take, and my job is to ask questions around it. So when that's happened, how long you had suffered with pain, is there anything happened during that time, maybe stress, maybe some trauma happened, direct or indirect trauma, maybe emotional trauma happened, maybe not an impact of a physical impact, but an emotional impact. But also I quite often ask if people had surgeries when it comes to the pelvic pain, and if they had any kids. So if they had childbirth, then we have to ask, was it a vaginal childbirth or was it through the C-section? Because that also would give me a history if anything has been disrupted as well through that process. So why and where is that pain coming, and why is it happening? So instead of going into fixator mode, it's easier to to ask and say why this is happening and what is driving this pain. So yeah, working very much with their clients and listening to what they have to say. So always like, being investigator.
It sounds like a cool position to be in, to be, as you're saying, there's like detective, almost seeking to connect the dots from a holistic point of view, and looking at all these multiple factors, like you mentioned, biological factors, which could be, for instance, as you say, scarring from surgery, or emotional factors, or environmental factors. What type of environmental factors do you typically look for? Like, what could be some examples?
So sometimes people, let's say they maybe are going through the divorce. Let's take like that case, and they still live with the same person under the same roof. That's what it could cause. That could be a trigger. That is driving on a daily basis, build up tension in the body, which will start tightening up the muscle, but also this emotional tissue called fascia, which is a sensory tissue in our body and surrounding everything. And that is basically feeling everything what we happening, and that's going to start tightening and compressing and moving things out of alignment and shifting and responding, because the nervous system leaves there. Also going from specialist to specialist to specialist, that's an environmental factor, especially when the vaginal pain, like people might be not really listening and saying, yesterday I had quite consultation with someone and said, I've been telling my client, my doctor about this issue. And I said that it's not connected. And so that's being shut down sometimes by another practitioner because they don't see connection. But they know they can feel it. So it's almost a matter of doubts of people going into that another practitioner and another practitioner. So that's an environmental factor, because they have to go from one practitioner to another practitioner and making sure that they are, like, someone confirms what they feel in their body, if that makes sense. So that also can feed the traumatic experience, which it is the pain itself in my creating. So you're relieving the trauma of whatever is happening.
Yeah, it's really interesting. I think that's a super important point, because that's a story that I hear so much from other women who experience vulvodynia and vaginismus. That is like the baseline is you have to see. I think there was a study that looked into, on average, women have to see 5 doctors before they get a diagnosis in the first place, which is a problem in and of itself. And then there's also the need to kind of be your own advocate normally for setting up like almost like a specialist team around you, because typically it requires like a multidisciplinary team of, say, a gynecologist, a physiotherapist, maybe a psychologist or a sexologist. And women end up being this like manager of their condition, which is maybe in some way good because it gives you a sense of I'm in control, but still it's not ideal because it's also makes you very vulnerable to, as you say, having the door kind of shut in your face from medical practitioners who we often look at as like above us in some way, like they know more than us, and they're saying that there's no connection here, there's nothing wrong, and then that medical gaslighting can be very problematic, as you say, in terms of like enforcing this view that, okay, but then there's something wrong with me, like what is there's something intrinsically wrong with me.
Exactly. And imagine during that period of advocating for yourself, this is emotional. You causing yourself the emotional impact on the body. And that emotional impact itself can drive the tension in the pelvis, because while you're trying to sit there and while you're trying to advocate for yourself, in the same time, you're drawing that pelvis to close. You clench. You usually, a lot of people not notice, but they might be clenching their inner thighs. They might be clenching their bum cheeks. So, all the muscles and all the pelvic floor is becoming actually super tight. And itself, and it stays in that pattern each time they might be going to the new practitioner, because there is a nervous system connection with the emotional connection and the thought connection. So there is a very big biopsychosocial a connection there, which I explained, like pain, emotions, and mental thinking, the environmental, which can actually stack in the loop and drive that pain even more.
Yeah, it's interesting that you mentioned this biopsychosocial model, because actually the previous episode that we had on this podcast was with a leading researcher called Dr. Claudia Kisari, exactly, and her work focuses exactly on the biopsychosocial model. So it's cool to hear you as a practitioner like using that in practice, and and what that might look like in terms of assessing and then treating someone based on that way of thinking. So it's really cool. But let's zoom in on fascia. You mentioned it a bit already, and I think it's super fascinating. So first of all, what is fascia and why should we care about it when thinking about pelvic pain?
Well, imagine that fascia is this internal scaffolding that holds everything in the body. It's like a web, a spider web that basically help us to connect, surrounds everything in the body, surrounds the muscles, surrounds the joints, surrounds the bones, surrounds all the vessels, blood vessels in the body, and holds everything together and in the one structure. So that's why I like to say that is the internal, you can take everything off, but fascia is that internal scaffolding that interconnects everything. It goes around the cells and these organs, which is super vital, and the bones, and it's just can dysfunction and tension in one element can actually put the tension in another part of the body. So that's why looking and taking into consideration fascial network, it helps to connect, and quicker for practitioners like myself who dealing with myofascial release and the lines and chains. It helps us to actually look more globally as well and ask more better questions and connect those dots much better, because we understand that there are certain lines. Tom Myers, which is founder of Anatomy Trains, he talks about fascia in lines and chains, help us to explain better for patients, like, well, that's your pelvic, it is connected to your jaw, or it is connected to your foot, or it is connected to your breathing. So if you imagine, I have put this fishnet sock around my hand. So for those who listen and don't see, if you take like a fishnet tie or a sock, you can see that little eyes and little connections, and all of that is interconnected. And if you disturb any part of that, you will start creating tension, and that starts moving and pulling on each other. And that's what that fascia does. So any pain, like, it can disturb anything. Also, pelvis itself is a sensory, has a lot of sensations because of the nerve ends. And then the nervous system itself, the ends of the nervous system are embedded in fascia, which recently the newest researchers of Dr. Robert Schleip, he are indicating that fascia is the sensory organ, so it feels. So, yes.
Fascinating. So that means that the fascia feels through the nerve endings because they are intrinsically connected
and embedded. So imagine a jelly. I like to give a lot of analogies for people to
very helpful.
So imagine you making a jelly, and the jelly is quite nice and fluidity. and it's a fluid first. And then and then that helps to surround everything. So that fluidity in fascia is like in a jelly when we first make it and put hot water that allows everything to glide. So imagine you take a step and you load your body to move forward. So you need to move the tension and load from one part of the body into another part. So if we take a steps in a slow motion, then you put a step forward and part of your body moves forward and the other part of the body is still holding to the ground behind. And then we take another step and that's loading. So if that is in a fluid motion, it helps fascia health, surrounds everything. It helps that movement to go without any restriction, without everything movement. Then you start actually now the jelly starts setting and in fascia starts stiffening. And imagine you put some fruit into your jelly and then that stiffness starts compounding onto that fruit because it's set properly. So fascia can also set and get really compounded together and glue-like together, and that would start restriction that movement. So this is where that kind of fishnet tie, like for some who may able to see, if you do this, you can see that starts moving everything else because that part is actually stiff, and if you want to move, it starts becoming restricted. So that's also interconnect the tension and everything together.
So when you do work on someone and you feel the arm, can you then feel the fascia and whether there is like tightness in it? How can we think about, like, because it's helpful with these analogies.
Yes,
but you can actually feel the stiffness by touching the skin.
You can actually also touching the skin, also seeing so you can see how the skin looks like when it is actually well hydrated. We like to say the fascia is also needs hydration. And that hydration can not necessarily happens by drinking a lot of water, but actually by movement and not being in a static and repeated positioning. So you can see where the skin gets really tight, where is the area looks, there's a difference in the color. So the skin is less shiny. When you touch, you cannot move the skin. So nothing is moving very easily. And there is restriction. If you want to go from side to side, up, down, in different directions, nothing is moving. So you can actually feel.
Okay, interesting.
And you can bind things together.
And so, as you said, the fascia is like the whole interconnectedness of all our organs and blood vessels and muscles and so forth in the body. But so it's all connected. But then, as you said, there are some, did you say fascial lines that are kind of more important or more clear pathways, so to say, between connection of one body part to another? Is that kind of how to think of it?
Yes. So Tom Myers developed that ideology to look at the body through those fascial lines and chains. And he said there's about 12 of those lines and chains, which help us to see through the superficial layers and the deep layers of fascia. And those lines connect from basically top of your head all the way to the feet and the toes, and how they connected differently. Yes.
Yeah, and I love analogies, and one other analogy that might help the listeners of picturing fascia, which I heard recently, is that if you peel back an orange, the skin of an orange, then the white kind of layer underneath the peel is more or less like fascia. Do you agree with that?
Yes, so very much. Like I brought the little orange here to show.
Perfect.
So I wanted to actually you to look through that orange, and then you have the skin, and it's the same you treat as our skin. And under our skin, we have one superficial part of the fascia, which it goes down, which it helps the skin to glide and move back and forth and in different directions. And then if you think that you have the segments, and each segment of orange is coated in that white film once you peel it off, that first white film. So imagine that is another layer of fascia in our body that surrounds something else. And then the little droplets, also, if you always see, they are like a little burst coated also in that white film. So you can see how the cells, you could almost treat the droplets like the vessels and the nerve ends and the cellular level, because we have to feel about fascia like it goes into cellular level. So it surrounds absolutely everything in our body. I like to say that fascia not only surrounds and holds the body structure, but also it conducts the energy to go through it, through our body. So energetically, we are energetic beings. We have that, and it moves that energy, but also is a communication system for that nervous system. So it communicates, so the body can communicate with the nervous system, with those nerve ends embedded in fascia. So it's not only scaffolding and holds the structure together and help us to move and be more fluid in our life, but also is a sensory, and because through the communication with the nervous system, and it can respond by our nervous system telling us if we're safe or not. So when we in fight, flight or freeze, the fascia will respond to that by starting to slowly compress those structures, or maybe pulling the structures and gluing into the structures all together and creating restrictions. And while it does that and the restrictions or compression happens, that's where is the break in that communication and the energy flow. So imagine you have a cable, and that cable, where we know all, like we have cables and the cables start breaking and tearing and tearing off the first shell, and then it stops connecting eventually if the properly is broken and exposed. And the same happens into our body. We just don't think. I always say, think about our body as an intelligent machine.
It's so interesting hearing about this. And just so I understand the link between the nervous system and fascia, then the idea is that say our nervous system is activated in the sympathetic state, then typically our muscles will kind of constrict and get ready for running, for instance, right? And then the fascia steps in and makes the alterations necessary for that to happen, so that we can
So that's
act.
the fluidity of that. If you think we talked about the jelly at the beginning being in the water form, or more or less in a fluid form. So that fluid form helps that movement and move faster and stuff like that. And when it's set, the jelly is set, I like to say to my clients, when the jelly sets, then we have then the movement is restricted. So we might not be able to lift the arm. We might not be able to do all the things.
Interesting. And just so going back to the fascial lines or the fascial change, as you said, and tying it back to the pelvis, I'm assuming the pelvis is part of some of those fascial lines. Can you mention some of them or give some examples of why fascia is so relevant?
Pelvis is part of, I think, mostly all of the lines. All of the lines. The frontal, if you think about the front of the body, it goes from top of the head, like our front, and the legs, and down all the way to the toes, and that's two. See, we have superficial and deep line. So then we have one line which called spiral line, which helps us to connect the body crossover. So that's another one, and connects the back of the spinal muscles, and the pelvis is involved there as well. And lateral lines and the functional lines also are involving pelvis. Pelvis is one of the most important places we have. If we think about the blocks, so we have head, which is cranium. Then we have our rib cage and the gut, and that's another block. That's another block. And then the pelvis is one of the biggest blocks as well, because it connects the upper body with the lower body. So it's like another hinge movement. And then we have the legs. So it's really, really important. And if we think, it connects upper body to the lower body.
And I'm really fascinated about the relationship between the jaw and the pelvis. And you mentioned it a bit already, but I find that it's something that is mentioned quite often. But can you then help us understand how these areas are connected? Are they also connected via the fascial lines as well?
Yes, so there is a couple of fascial lines that connects the pelvis and the jaw together. There is a superficial frontal line. There is another deeper layer to that called the deep frontal line. And then we have the spiral line, which connects the body across and the pelvis at the back. So the front of the pelvis, like as an X, if you imagine the X, and at the back is connects also through the sacrum. Oh wow, there is lateral lines, so that's connects as well. So it's 3 or 4 really big lines that connect the jaw together with the pelvis.
Okay, interesting. So that's something that you see quite often in your practice, like tension in the jaw can mimic tension in the pelvis or vice versa.
Yes, so that's interesting thing, because what happens, the jaw and the pelvis, they actually are familiar from before even we birth together. So if we look on the embryology, when we have the embryons, there are 2 places that start developing at the same time, which is the cranium and the jaw, so creating opening at the mouth, and also creating the lower opening for the urination, digestion tract. So that's the pelvic tract. So that's the bottom opening, and that's all is from around about 15 days after the embryo is connected. So they both interconnected, and then you have the spine in between connecting those both things. So what we like to say, you have the pelvis is at the tail of the spine, and then the jaw sits on the top of the spine and it hangs off the cranium. So yes, so they actually interconnected and been developing at the same time during the being an embryo, still an embryo.
Fascinating. And so going back again to fascia, and what are some factors that can impact the health and the function of our fascia?
So I would say that another thing is repetitive movement that can impact. So if we sit maybe for prolonged time and we without movement, that's start setting. I like to come back into that jelly. So that's the easiest for the listeners to remember. Think about our body that is made 80% of water. So that's you setting that jelly from the freshly made watery base into the proper hard base jelly. But also scars. The scars are actually can break the continuity of that.
Like literally cutting into the fascia.
Cutting into the fascia. So imagine that any surgery or deeper cuts can break that continuity of that sock. So imagine like you have this beautiful tie and then you make the hole in a tie. We break that continuity, and then when we sew something in, then it starts creating little tension movements, because it's never exactly the same. Fascia is never exactly the same. It would repair, but it might need a help to repairing in a much better, calmer state for that.
Okay, interesting. Yeah, I personally have had abdominal surgery through. They thought I had appendicitis, so they cut open through keyhole surgery. But that would indicate that maybe in that area there is either some restrictions around the fascia in that area, or maybe even scar tissue that does that function as restriction basically if it's
Yes,
scar
it
tissue?
does. The scar tissue can function as. So imagine that's the collagenous tissues are trying to continually connect with each other, and then they might not have the easiest process to connect back, and they might try to knit itself into the hip, into the rib cage. At the moment, I'm looked yesterday at someone who had keyhole, and I can see that even very freshly 4 weeks after, the scar is trying to knit itself into the rib cage, one of the ribs. So that can create a restriction and build up that tension. So I want listeners to think about the whole body connection at the.
And so the relevance of fascia then, just to reiterate, is that tension in certain parts of our body can impact our pelvis as well, which can cause restrictions, and then also pain in some cases, or tightness of the pelvic floor muscles, for instance.
Yes, because we can have traumatic events like falls. A lot of people take that's not a massive injury, but that is an impact injury. And that little fall can actually move the pelvis ever so slightly, and that coccyx will drive the positioning of the hips maybe into a forward facing tilt or backwards facing tilt, and that can put impact on your back. You can require back pains and adjust the patterns of how you breathe, so change the breathing pattern.
And so when you work with fascia, you mentioned earlier something called myofascial release therapy, right? What does that entail? How do you work with the fascia, and what does myofascial mean?
Myo means muscle, and then fascia is that connective tissue. So it's basically that orange philosophy showing you how that everything is surrounded in that fascia. So if you think those juicy little driplets inside the orange to be that muscle, so the muscle is surrounded by fascia, but also fascia goes through the muscle. So when the fascia gets restricted because maybe of the repetitive movement, the impact injury, the emotional impact on the body, that could start stiffing, and that prevents us gliding. So all comes back to that jelly analogy. When the fascia sets hard in the body and is compressing somewhere, we can use different methodologies, and there are different now ways of releasing fascia. So it became very popular, and there's more and more ways. The easiest way is through movement. We can move better and regularly, so that's we hydrate in fascia.
Is there a specific type of movement that is more beneficial?
For the pelvis, I would say moving every so often, just standing up and walking. So walking is the easiest way of movement because everything moves, and it helps the brain and nervous system to process the new movement. But also the number 8. Figure 8, moving the pelvis in figure 8, so in different direction, moving to the side, moving to the front. So that's yoga positioning, or cat and cow positioning, where we're moving the spine and mobilizing things, and using the breath as well through. So breath, it can be a very big hydration into mobilizing that fascia and hydrating that fascia. But so many people hold in the breath, which can restrict and compress the fascia.
I love those practical tips that people can integrate very easily into their day. So like walking, stretching, doing like simple yoga stretches, doing gentle movements, anything else, and breathing, anything else that we can do on like a daily basis in the comfort of our own homes to nurture the fascia.
Yeah, so if we work in more these days, we having more hybrid works, or so then we sit more for prolonged times. Just just put a reminder on your phone to get up and move every hour. That itself can help fascia and the body to move from that harder set motion into that fluidity. But also paying attention, putting hands on the hips and helping fascia to melt and being conscious and present. Fascia responds to being present. It's not also enough to get all those, do the things and people say, oh, I'm doing all of those exercises and nothing happens. Being present and noticing any sensations that are happening during that time. So I like really, really powerful, and one of my clients found it really powerful for her pelvic pain. It was when you wake up in the morning, put your hips on the front of the body like this, like a triangle almost, and hold there and just gently place the palms of your hands on the pelvis and around and your belly, or maybe one on the belly, one on the heart, and just breathe in and breathe out for about 2 to 5 minutes. And that also helps to melt, but also bring that safety into fascia, because there's a lot of nervous system there in pelvis. So we have to be mindful that the pelvis and the jaw are both emotional, and they respond to the emotions, especially in women. So they can close during emotional problems and distress, and then they can create that stiffness. So movement and being present and connecting with part of your body to allow your body to feel, okay, I am being listened. That will itself help you to tell your nervous system, which is stuck maybe in fight, flight, or freeze, to say, I'm safe. That simple touch of your own can then indicate safety for the nervous system, and the nervous system can help fascia to let go. So that simple thing, morning and evening, placing the hands around your pelvis, can be a powerful tool to help you to minimize and reduce that pain, because you're working being present, and you're working with your nervous system and working with fascia, because you're connecting and allowing that tension and allowing that nervous system to feel that it's safe, because I place my hand there, is safe there. So I like to say we're repatterning and we're reteaching the nervous system that is safety there, that we can actually minimize that fat, and slowly over that period of time, the pain might reduce and you might feel calmer, so the stiffness also will reduce.
I think that's a really beautiful way to end this episode. I think it's a good reminder that, as you say, the fascia responds really well to softness, and fascia is such an integral part of our body, and it's a fascinating organ, and it's it's something that can teach us a lot. So it's been such a pleasure talking to you, Violet. Thank you for sharing all your knowledge on this topic with me. It's just super fascinating.
And thank you for having me.
And how can people connect with you? How can people work with you or follow your work in some way?
So at the moment, I'm currently on Instagram under the handle of battersea.massage, and they can find me there and connect through there and go onto the website and reach out and book for the free consultation I have online, and we can start the conversation there.
Fantastic. And do you do, because you're based in Battersea in London,
yes,
in the UK, but do you do also virtual treatment or just in person?
We can start bringing that knowledge and understanding, because I always say, when people don't understand when things are coming from, then that creates additional stress and puts additional stress on the body, and that can create pain. So starting with there, then we can start doing simple exercises like this, where we guide the body through breath. And yes, there's always way of maybe a new way for me to work with the clients as well, using the own powerful body as we can heal ourselves.
Yeah. Beautiful way to end. Thank you once again for your time, Violet. It's been such a pleasure.
Thank you for having me. Thank you.
Thank you so much for tuning into the podcast. I truly hope that you enjoyed this episode and that you learned something new. As always, I'm super keen to hear your feedback and any questions that may have come up in this episode. And I'm all ears for any topics that you'd like to be covered in future episodes. I really love hearing from you and interacting with you. So you can reach out to me through our Instagram, which is @meet.babu. I'll link all of that in the show notes. And I'm looking forward to seeing you next time for another episode.